Good morning. Today is Saturday, April 22nd, 2023. Let me do some sound check. Check, check, check. Let's see if we get your sound right. Yeah, perfect. So today is again Saturday, April 22nd, 2023. Today is called the Earth Day. Now, people who are watching and following with me, you need to know this very, very important day today. Earth Day was established in 1970, April 22nd, 1970, for the protection of the environment. And every year we're talking about the changes, the climate changes, and what we can do. And this year, 2023, the goal is to invest in our planet. Now, what has yoga has to do with the Earth Day? Question about Earth Day, about environmental protection is we are destroying our Mother Nature to cause these environmental changes, and for which we need a protection. Practice of yoga is a work in, not a work out. Practice of yoga is an introspection, looking inside yourself. Practice of yoga is a self-realization. Realization, as we all talk about, is called real eyes. Real eyes means instead of looking outside, your eyes are turned backwards, so we are started looking inside us. So what this has to do with a protection of our environment? Now you are conscious enough with your introspection, see what you are doing to destroy our Mother Nature. If you're not looking inside, what we have seen, especially in our family, we can share with you what we are doing. Instead of doing XYZ, we find it out is the waste. If you cut down your waste, that's enough for environmental protection today. Water, people talk about water, crisis of water. There is no water in Africa, no water part of the world. You know, what you need is to stop wasting water. It's not how to conserve water, it's to stop wasting. We waste too much, wasting food. Anyway, let's start today's our practice after Earth Day. Our Saturday sessions are based on two things. First one, obviously, people's request. I get enough request to present the yoga therapy for different conditions. And second, we present based on our clinical experience and our yogic experience. And always remember, we practice with a health tracker. The moment you practice with a health tracker, you are in the position to self-care of your health. Now you know exactly what you are doing, including how you are destroying your Mother Nature. That also comes from here. So today's topic is yoga therapy for frozen shoulder. What does frozen shoulder means? It is a very common condition. Shoulder joint is a ball and socket joint. Our most complicated joint, obviously, in our hands, in our wrist, too many bones, and too many joints, whatever we are doing. Elbow is a hinge joint. It has only external rotation, internal rotation a little bit, and mostly hinge, and shoulder is a ball and socket joint. When you have a pain in the shoulder, either due to trauma, inflammation, damage to your bones and cartilages, first thing you do, you stop moving your shoulder. When you stop moving your shoulder, that becomes what is called a frozen shoulder. Frozen shoulder means you are losing all the function of the joint. When we start a practice, we look into it. What is the cause of the shoulder pain? First, the movement of the shoulder, the movement which is going to hurt the shoulder. That means this bone and joint, the cup, there is a cartilage called a labrum, and the head of the humerus is in that cup of the scapula. It has all different functions, which is called a adduction, a deduction, bringing your hand close to your body, abduction, raising the hand all the way high up, abduction, AB. Rotation, you have a lot of rotation. Then external rotation, you turn your hand all the way outside, and internal rotation. Shoulder joint is made to work in a box. You work here. That is the working area of the shoulder joint. The one which is going to hurt you most, the shoulder joint, is called an external rotation. When you rotate your shoulder outside, and also abduction, AB abduction, abduction, especially what is called a hyperabduction. Hyperabduction is very common. You have an object, you want to put all the way up somewhere, and you try to put going up because of hyperabduction. One of the most common scenario is the putting your hand luggage into the plane. When you're in the plane, you want to put your hand luggage on the overhead bin. That is one situation. So what it does, when you're stretching it, you cause a little tear or stretching of the ligaments. Ligaments are which is connecting the bones and joints. Also remember, all the pain fibers are located in the ligaments and also in the muscles. Cartilage doesn't have any much pain fiber, and bone probably not. Bone marrow may have some. So when you have a trauma, like an injury, you develop an inflammation called traumatic inflammation. Example being, if you hurt your thumb, suppose I hurt my thumb on this door or in my car door, wherever, I get a pain because you have stimulated the pain fibers. Next day, it becomes red, swollen, painful. There's exact sign of inflammation. There was no infection, no bacteria, nothing. It is called a traumatic inflammation. In a traumatic, when the inflammation starts from an injury, especially it's called the rotator cuff. And very common thing you will hear is called rotator cuff tear. And rotator cuff tear, we have so many people rotator cuff tear, you don't even know unless it is symptomatic, unless it is become very acute. If you take the people out of the street and look at the rotator cuff, I don't know the exact percentage and I'm not an orthopedic surgeon, but large number will have a chronic rotator cuff tear which are asymptomatic. So, what are the protections you need to do? Also, a frozen shoulder also comes from called a dislocation of the shoulder. It's called chronic dislocation, happened many times. There's two types of dislocation called an anterior dislocation and a posterior dislocation. Posterior dislocation is extremely rare, and your anterior dislocation is very common. Anterior dislocation, generally you reduce, you'll see the whole ball has come down a little below, you push your body and then push your hand, your external rotation. A lot of names in this maneuver in orthopedics, in your osteopathic, chiropractic places. But remember, the protection of your shoulder is your internal rotation and adduction. So what does it mean? Suppose you have a problem in the right shoulder, especially you have a, say, recurrent dislocation or a rotator cuff tear or a chronic pain. If you sleep, so remember, we yogis, we sleep on one side. Preferably we sleep on the left side, we sleep on a fetal position, we do not sleep on our back. So when I sleep on one side, say if I'm sleeping on my left side, if my right shoulder is up, at night during sleep, when a muscle gets relaxed, you may develop an external rotation, which is going to be very harmful for your shoulder. So the recommendation is, if you sleep, especially if you sleep on the side, sleep on the side of the shoulder joint which is causing or giving the problem. Okay. Second, when you have the pain, you are so fearful not to do anything. It's the same yogic concept. I know you have a painful shoulder, but if you keep your shoulder at this position, adduction and internal rotation, you don't have the pain. And due to lack of movement, you are developing frozen shoulder. So if you start doing little bit of movement in all these yoga asanas and pranayamas, which we are going to show you now, that if you do the little movement and with a symptom called comfortable discomfort without much pain, or maybe with a little bit of tolerating pain, you will develop neuroplasticity. That means if you're able to do it here today, and within a few weeks you're able to do more, then you'll be a lot more and able to do all the way higher. Neuroplasticity is a phenomena of yogic asanas, which we call a habit forming. Now, you also have so many different names of the shoulder. Like if you go to orthopedic surgeon office, there is an orthopedic surgeon specialized in the shoulder. I could give you a name. subacromial capsulitis or subacromial pain syndrome. Basically, what it means that you really do not have any bones and joints injuries or bones and joints degeneration. It is all from outside the joint. So, there is no therapy better than a yoga practice, especially a Bhastrika Pranayama. As you know, Bhastrika Pranayama is the pain reliever. What it does, you bring more oxygen. End product of food is a glucose, combines with oxygen, forms carbon dioxide, water, and ATP, adenosine triphosphate. And ATP is the energy. If you don't have enough oxygen, glucose combines and forms your lactic acid, pyruvic acid, pain-producing substances, which goes washed away and it relieves. Relaxation response, activation of parasympathetic tone helps. So the first what you have to do, you have to relax your hands and shoulders. So hand gets relaxed with your, like a baby fist, Balo Mushti Mudra or Adhi Mudra. So they'll put your thumb inside and close. Like a friend of mine called me, he's a trigger finger. I don't know what is called trigger, it comes and just triggers up and gets in the morning. He said in the morning you do a Balo Mushti Mudra. Do with your breath. Breathe out first. Take a deep breath in. Breathe out the Balo Mushti Mudra. Shoulder gets relaxed with extension and then flexion. So you can extend your wrist and do the Balo Mushti Mudra with your breathing. Breathe in, breathe out. You think they look so simple, but these are a wonderful yoga therapy performance. Money back guarantee with any hand pain, wrist pain. Elbows, as you know, gets relaxed on internal rotation. So we'll do a prayer pose to the back. Paschim Namaskar. And that is the first asana you do for frozen shoulder. Maybe, pictures are getting smaller and smaller. Okay, maybe I'll go down. Let me go down to the floor and then I will show it to you. And all these things also can be done, as you know, they can be done on your sitting in a chair. Okay. So now you have a frozen shoulder. You have a painful shoulder. What to do? Well, first asana for the painful shoulder is slow movement of your shoulder. So ball and socket joint. So slowly see if you can raise your shoulder high up and rotate a little bit. Do with your breathing. Breathe in, breathe out first, like all the yogic practice. Take a deep breath in and breathe out. Shoulder movement, and it's a rotation. And you can use your hand on your knees and the hands will guide you to your shoulder rotation. This is the front rotation, then you can do the back rotation. Now first, if you say, I really don't want to do it, it's very painful, do it very slowly. You remember, in stages, impossible become possible. If you don't want to do it, it's fine with me. Go home, take some pain medication, and then when you start having problem, complication of this medication, and you will see that you are always trying to do that. And this is a daily practice. If your wrists are relaxed, it helps in your shoulder. You know, our yogic principle, it is a holistic practice. It is not a reductionist. My wrist is relaxed. How do you know? Put your wrist here, and sitting here, you will be able to go and put your whole wrist down. It hurts, back off. Stay here. Pain here, back off more. Close your eyes, do your breathing, breathing out longer than breathing in. Coordinate your movement, and slowly this thing is going to happen. So movement of the shoulder, front and back. We also do this with little bit of a weight. You take a little dumbbell. If you start at the beginning, take a 5 pounds, 10 pounds, 15 pounds, what is comfortable. And with the weights, you do the front and back shoulder movement. Skandha Chalan Asana. Skandha is a shoulder, Chalan is a movement. Skandha Chalan Asana. Elbow rotation, put your hands in the shoulder, put the elbows together. Now remember, you listen to your body. What is the body signal? No pain. If you get a pain here, back off. Remember, yoga practice is introspection, looking inside you, and effortless breathing. The moment you're able to talk, able to sing in the whole yoga practice, you are doing yoga practice. Breathe out first. Take a deep breath in. Slowly rotating, breathing out. Breathe in. Breathe out. Always do with your eyes closed, so you'll be able to follow your elbows and the joints. Do it at least 5 to 10 times in each posture. Then you do opposite. Remember, balance. Breathe out, then breathe in, breathe out, do the opposite side. Breathe in, breathe out. Yoga therapy for frozen shoulder. We are what is called a money back guarantee. No question about it. You know, yoga therapy is extremely good medicine, but it's a very slow medicine. It is so slow that its attrition rate is very high. Hold your wrist in the top, breathe out first, take a deep breath in, slowly put your hand down behind your head. Bring it up here, breathe in, breathe out, and the same breathing cycle come back in the middle. Breathe in, breathe out. I love this. Oh, it is so comforting, so relaxing. People get a concern. I had a shoulder dislocation, I had a frozen shoulder, I had arthroscopic surgery, I had the ligaments tightened up. Nothing is going to restrict you when you follow your body sensation of pain and effortless breathing. Bottom line of practice, do not take a pain medication and start a yoga asana practice. In neck relaxation also helps your shoulder relaxation. So if you're doing, you can do a lot of, we'll show it to you when you do a neck pain, but if you do a simply movement of your neck, breathe out first, deep breath in, breathe out, slowly move your neck without any pain. So you go to the right, to the back, to the left and the front. Then you go to the left, to the back, to the right, to the front. In the meantime, due to your relaxation, you are also doing your also relaxation, you are also relaxing lower part of your body. From Sukhasana, go to the Siddhasana. D-therapy, 3 times, D-therapy is the Bhastrika Pranayama with the movement of the shoulder joint. See, we do these practices every single day. But when you come to the disease-specific yoga therapy, we do pick and choose from our daily practice. So what happens in our daily practice that really cover most of the chronic ailments we have. So the technique is you sit down very comfortably, either in a chair or in the ground. Then, very simply, you can do very slow movement of your Bhastrika Pranayama. You can do a rapid movement of Bhastrika Pranayama, and you can do a very simple sitting in the Bhastrika Pranayama. You can slowly raise your hand high up. It doesn't matter where. If you can raise even up to here, keep it. Start where you are. It is an individual practice. So if you go all the way high up, active inhalation, active exhalation. Breathe out first. Take a deep breath in and slowly pull it down with a Adhimudra. Breathe in, breathe out. Do the eyes closed with the shoulder joint movement. As I said, this is going to be a money back guarantee therapy. Now you do a little bit longer breathing with a little bit of faster, then you go on we call it a slower speed, medium speed, and a very rapid speed, which you do for daily practice. So you can see, you can do almost like your yogic breathing. Practicing with me, you can also practice with me. As I said, you will generally we practice it 20 in a slow pace, 20 in a medium pace, and 20 in a rapid pace. So that is our one cycle of Bhastrika Pranayama, and we continue 2 cycle, 3 cycle, 4 cycle, our everyday practice. It's wonderful for our shoulder. So let's show it to you again. Slow speed. In fact, when you're doing a yogic terms, we call it a Ishwar. 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 Let's do 10 times just to show it to you. You know, we do a lot of many numbers, but for the sake of time, we cannot do those practices, and I'll show it to you. Practice like this. Wonderful practice. Wonderful, wonderful practice. Go a little bit faster. Soham. Ishwar. Soham. 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 Do 10 counts of that like this. You continue more. How much you continue? As long as your breath is effortless. The moment you get an effort in the breath, you stop. People ask me, how long you're going to do? You know, when you're beginning, you may be able to do only 10 seconds, 30 seconds. Your breath is your guide. We've been doing for so long, we can do for minutes and minutes, we can do 3 minutes, 4 minutes, 5 minutes, but our breath is effortless. Ishwar, Soham, then it comes in a speed called a Vishnu, Vishnu, Vishnu. The rapid Bhastrika Pranayama with the shoulder elevation. Vishnu, Vishnu. So, let's show you one cycle. What you do for Bhastrika Pranayama, which will be your money back guarantee for your shoulder ailments. So we'll do 20 slow, 20 medium, 20 fast Bhastrika Pranayama. Eyes closed, concentration towards the shoulder joint, no pain, and effortless breathing. Medium. Rapid speed. You do it on your body's response without any pain, with effortless breathing. So I'm talking. Breathing. I'm fine. You also can do with the shoulder movement, very simple, gentle, with your Bhastrika Pranayama, like this. You start it at the beginning. You can do a very simple raising with the breathing out first, breathe in, active inhalation, active exhalation. Then go a little bit of a rapid speed. First question is, oh, my other teacher told me not to do any fast, very slow. Yes, you start very slow, you start everything, but you keep on raising your speed without any effort in your breathing. So what will happen, you get a parasympathetic activation. So I'm having a lot of saliva in my mouth now. The saliva in your mouth, I've been talking for a while to you, didn't drink any water, but I have a saliva in my mouth. My mouth is wet. So let me show you how we do. I'll do my eyes closed. I'll be counting subconsciously. See how far I can do. And generally I do with a Adhi Mudra, Bala Mushti Mudra. It's a very relaxing mudra. My whole body is warm. I'm having some symptoms of hyperventilation syndrome. I'm still talking. My breath is still effortless, but my shoulder joints are as relaxed as can be. But we always have little bit of discrepancies because of the tightness and spasm of these two muscles, trapezius muscle and sternomastoid muscle. So what you can do many a time to relax these muscles, sternomastoid turns your head on both sides. You can do the sternomastoid and you will see the relaxation of the shoulder. So it's a very nice technique. Turn your neck once. In fact, if you have a neck pain, shoulder pain, turn it just short of pain. And from here, you do the Bhastrika Pranayama like this. Do the opposite side too. On the opposite side, same thing. Wow, what a wonderful practice, huh? Actually, we'll do another practice, a pranayama practice for the frozen shoulder, because it's very important. A lot of people are having frozen shoulder. See how many people are having shoulder joint replacement now. How many orthopedic surgeons are in town who are only specialists of shoulder? Paschim Namaskar is the ideal asana for your, before Paschim Namaskar. Slowly you do, it's called your Gururasana or eagle pose with hands. When you stand up, cross your leg and cross it. So take your hands, turn around and put your hands around and stay in this posture. And feel the little tightness in the shoulder and feel the relaxation. Close your eyes, breathe in and out. Breathe out longer than breathing in, between 5 to 10 breaths. Gururasana with the upper body. Opposite side, turn around, other hand, Gururasana. Wonderful practice for your frozen shoulder and any shoulder health. 5 to 10 breaths, very important. The therapy from yoga asana practice is your Paschim Namaskar, prayer pose to the back, and Gomukhasana, cow face. Let me show you both by turning around so you'll be able to see both of your hands. Sit down comfortably in a chair or in a mat. Slowly bring your hands wherever you can. Initially, when you have your joint pain, shoulder pain, you may not be able to come here, you may be here. But wherever you are, close your eyes and always coordinate your breath with your asana practice. Slowly your hands will touch here. With the neuroplasticity, with the statement, in stages, impossible become possible, you will have this situation, the prayer pose to the back, Paschim Namaskar. Close your eyes, stay in this posture to create the relaxation response and the parasympathetic activation, which will be shown to you with the saliva in your mouth. In time, so we go high up. I don't know how long it will take. It takes time for different people, different timing. And this is a part of your daily practice. In fact, people who are using computer throughout the whole day, our recommendation is sitting with the spine straight, and after a few minutes, maybe an hour, sit in the same spine straight and do the prayer pose to the back, Paschim Namaskar for a while. Gomukhasana, cow face. I'm showing you what is our transformed yogis do. But remember, yoga therapy is the art of transformation. We go from rogi, people with disease, to nirogi, people with no disease, with the yogi, the healthy and happy person following the daily routine of yoga. Now, we're sitting in an asana called your Vaisasana, one knee in the top of the other knee. For me, my right knee is in the top of my left knee. My right hand goes high up, left hand comes in the middle. Let me put the left hand in the middle. The right hand will drop down, it will touch it, it will hook it, and essentially at the end I will be able to handshake each other. Completely effortless practice. There is no pain. Breathing is effortless. I'm talking, I'm singing. Staying here between 5 to 10 breaths, breathing out longer than breathing in. Frozen shoulder will say again, this is not the body I need to be here. It's going to run away from you. Balancing, doing the opposite side. Changing my feet. Now my left knee is over my right knee. Give it time for relaxation to set in. The left hand goes high up. Right hand comes into the middle. Left hand comes down, you touch it, you hook it, and essentially again, you handshake each other. Many a time you'll notice your one side is easier than the other side. That is the imbalance we have. But once you're in balance, we get into both sides equally. And no discomfort, no pain, effortless breathing. 5 to 10 breaths. Gomukhasana, cow face. The therapy for shoulder pain and frozen shoulder. Sitting down, you can do a lot of asanas. But one asana which will put a little strength in your shoulder. Another important concept is if you have a strength in your shoulder, strength in the shoulder, strength in your arm, strength in your hand, it helps in your shoulder. So this is Dandasana, spine straight. I do lot of relaxation of your feet. Hands are grounded. Then do a Vakrasana, spinal twist. See how it helps. Right foot comes against the left thigh. Right or left hand comes outside your right knee. Right hand goes to the back. Left hand comes down and touches your shoulder. What is doing, here you're breathing out first. Okay, taking a deep breath in and slowly turn your body towards your right side and breathe in and out. You can feel the stretch you're creating in your shoulder joint. Same way to the opposite side. And remember, this is a very relaxing practice. You have an effortless breath. We're talking, we're singing, we're breathing, we're enjoying what you are doing. It is not that we practice for 2 hours, 3 hours. We don't practice throughout the whole day. We practice with our effortless ease. This is D-I-S space E-A-S-E. This is, therapy is effortless ease. Sanskrit called ashuk. Same way, left knee going to the right side, right arm and elbow, go outside the right knee, left hand goes to the back, right hand comes down, touches the knee. Again, breathing out longer than breathing in. Turning your body away from you and breathe in and out. So nice. Powerful tool for yogis is called Dan Baitak. So let me show you a little bit of power in your hand, power in your shoulder, which helps. We'll be talking about pranayama for frozen shoulder in our next session. So, done by tuck. Done is the push-ups. There's a lot of yogic push-ups, and let me show you some of them so you'll understand how it helps your hand and shoulder. Other asanas called a peacock, Mayurasana, Mayuriasana, then your Tulasana, raising your body high up. This is all primarily the hand strength, but it helps in your shoulder. What also helps your shoulder, and there is a lot of studies have been done, is your shoulder stand, plow, and a headstand. Isn't it? Yogis can do all this stuff. Okay, let's start with the push-ups. Push-ups will start with what is called the Adho Mukha Svanasana. English we call it downward facing dog. So, hands here, feet on this side. Can you see me? Yes. Shadharandan, the simple push-ups. You go down and come back high up. Shadharandan. Ram Murtidan. Ram Murti was a famous yogis. He goes down like this and come back in the same way. Try this. If you're doing with me, try this. Go down this way and come back in the same way. Ram Murti Dan. Hanuman Dan. Bring your 1 foot high up. Go down. So you get it down. It will be high up. Most powerful of this, all the dans, there's a lot of dan. Brishchik dan, Sarpa dan. You show the Misra dan. Misra dan, if you can do Misra dan, very good for your hands and shoulder. In Misra dan, come to the front, put your hands. You push yourself to the back and then push up, like this. Go back and then push up from front. Go back, push up, come back. Done by tuck. Tulasana. Okay. Sit down in a Padmasana, lotus pose. Whole body will go high up on your hand and the strength being transmitted to your shoulder. Hands on both sides. Raise your body high up. Breathe out first. Your whole body goes high. Steady. Tulasana. This is my place. This is my room. This is my computer, my books, yoga place. I just opened the door a little bit. What's next on the hand? Oh, Murasana. Peacock pose. People think about, there is nothing called difficult asana. You relax your body, let go. Every asana will come to you. Every practice will come to you. You don't have to chase after the practice. Practice will be chasing you. Putting your hands backwards. And I hear from a lot of people, when I do that, my wrist hurts. What will be your answer? Don't do it when you have a pain. So what you need to do, you practice on the wrist relaxation so the pain in the wrist goes away. Get your body high up. Push your body weight on your elbows. Push your body in the front and your whole body will go high up. Stay there a little longer. I will show it to you. I just want to show the technique if you want to learn. When you put your body weight on your elbow, don't try to raise your feet high up. It's not going to work. Push your body in front. When you push your body in front, your feet and the rest of body will go high up. A lot of yoga practitioners talks to me, said, wow, this is the most difficult asana. This is the mother of all the asanas. I said, no, this is called relaxation response. When you relax, you do it. Okay, again. Hand. Positioning of your hand. So nice, so easy, so comfortable. High up, elbows bends, body is in the weight and elbow, body goes in the front, and your back is going to go. When you talk and do all this stuff, see, this thing you do with your effortless breath, but also do with your some kind of subconscious concentration. It's okay. When you're demonstrating it, okay, Mayuri asana, you go one farther. We call it patho-physiology, or this is a female version of Mayurasana. So you are doing a lotus pose. Basically it is a Mayurasana on a lotus pose. Tadavasana, the lotus pose, you put your body down. It's called your Viparit Matsasana, opposite fish pose. Then you put your hands in the back, called Paschim Namaskar. 3 asanas together, your whole shoulder, elbows, wrist, everything will be wonderful. Same technique. Put your elbows here, put your body weight on the elbows, push your body in the front, and your body is going to go higher, even if you're in a lotus position. Mayuri asana. Tadasana, Mayurasana, Mayuri asana. What more? Shoulder stand, plow. Yogic sit-ups with your hand in the back. It's another one very good for your shoulder. Remember, these are all the part of your daily practice. We don't invent anything. We use the same yoga practices we do and we adapt it for the disease-specific yoga therapies. So laying down, and if you do sit-ups, touch your feet. This is good. Go down and get a sit-ups. Then what you do, put your hand behind your head. And you will see initially how difficult it is. And you do your sit-ups. You do sit-ups from here. Hands in the back. Sit-ups with your hand to the back. Shoulder stand, Sarvangasana with the plow, Halasana. Excellent for your shoulder and upper body. Go all the way up as a shoulder stand. From here, you go all the way down in a plow or a halasana. And put your head down. There's a lot of studies done. You'll find in the literature for the shoulder, for the yogis, one of the ideal practice is your headstand, Shishasana. And always remember, you do not talk to anybody about your Shishasana practice. Talk to your friends, they'll say you crazy, you're going to kill yourself. Talk to your doctors. Oh, you have a neck pain, don't do it. You have a this pain, that pain, shoulder pain, but no. What you do in a headstand or Shishasana, you practice it in stages. Practice in a neuroplasticity. Practice without any support. And practice on your body symptoms, especially breath and the pain. It is the most relaxing asana, and that's why the whole shoulder, upper part of the body, everywhere get relaxed. So you start first with your Vajrasana. So a Vajrasana is also a very relaxing asana. Thunderbolt. Spine is straight, body is erect. Hold both the elbows, put it down. This is your place of your support. Clasp your hand, put your head down. You will feel miserable. You cannot talk, you cannot breathe, your body is all flushed, face is flushed, your intracranial pressure is up. Intraocular pressure means pressure inside your eye, pressure inside your brain, pressure inside your eyes.
Pressure inside your carotid arteries, all high up. Body is not allowing you to get the head down, feet high up. Keep it down. Keep it down for a while. Neuroplasticity will set in. A phenomena called baroreceptor sensitivity. Baroreceptor sensitivity will go high up. Your intracranial pressure will come down. Intraocular pressure will come down, pressure inside the eye. Intracarotid pressure, pressure inside the carotid artery will come down. You will feel a profound level of relaxation with effortless breathing. When you come to that state, what you need to do, you need to keep walking, and then you will see your body is going to go high up. Your body is going to high up and stay high up. So what you need to do, don't get any help from anybody. Do it on your own and get that feet will go high up on its own when your breath is effortless, when your body has no pain. In fact, let me show it to you how to do it at the beginning. If you do against a wall, because the headstand issue is the fear. Only fear is that you're going to fall down. And interestingly is when you fall down, you always fall down in the front. Somersault. We always practice somersault. So, if you want to see how you can do it on your own and slowly, can put your head down and slowly come in the front and go high up and put your feet high up against the wall and stay here. Close your eyes, do your breathing. See, I'm talking, I'm breathing, totally effortless. My shoulders are relaxing slowly. Feet is going to come down. I'm in a very profound, I'm not touching anything, I'm just outside. Stay here as long as I can and slowly come down. Sorry, irritation. Okay, so you've seen all the practices for the frozen shoulder, especially with a asana practice. We did a little bit of Bhastrika, Pranayama, but we'll show you more for the shoulder. How to do a shoulder using your hand and using your Bhramri Pranayam and using your Murcha Pranayam and Anulom Vilom Pranayam, alternate nostril breathing, and then the chanting. So do those pranayamas and we do with a movement of your shoulder and for the therapy of the frozen shoulder. Again, thank you for joining. If you have questions, send it to me. If you have any comments, put the comments on the Facebook. And as I said, I do come to Facebook. I do come every Saturday, and if I'm not here every Saturday, I do check and going to answer. Next Saturday, I'm going to be in New York, and I'm going to do a presentation for the
a physician group. The presentation will be a practice which is yoga therapy for health and healing, and there will be a formal presentation on your yoga therapy for prevention of cardiovascular disease. So the week after, Saturday, come back and have a practice of pranayama for frozen shoulder. Thank you again. See you on Saturday. And all of you, please continue practice and send a request what disease you want to see or you want to present.